Good morning. Today I like to highlight with you a very much important topics in human being. This is called idiopathic thrombocytopenic purpura. Idiopathic thrombocytopenic purpura. You should know. Look to my slide. Look to idiopathic thrombocytopenic purpura. Look, what is it? It is one kind of thrombocytopenia purpura due to autoantibody against platelet membrane glycoprotein. Remember this one. There is a formation of autoantibody against platelet membrane glycoprotein. Remember this one. How it is formed? Yes, this is upper respiratory infection. Any upper respiratory infection 2 to 3 weeks prior to the illness, there is a formation of autoantibody against platelet membrane glycoprotein. This autoantibody binds with the platelet. This antibody coated platelet when passing through the splenic circulation, then what will happen? Splenic macrophage recognize it, then engulf and destroy. This is called the thrombocytopenia. Remember this. This is the pathophysiology. Now you should know some terms. What is purpura? What is purpura? What do you mean purpura? Spontaneous bleeding or extravasation of the blood in the skin, which is not blanched. What is the blanch on pressure? This is called purpura. Remember this. Then what is the PTC? Thin fine macule of blood in the skin is called the purpura. Next, what is ecchymosis? Lost extravasation of the blood in the skin is known as ecchymosis. What do you mean by hematoma? That a fluctuating swelling or due to gross bleeding is known as hematoma. Remember this one. Now I like to highlight why this formation of this ITP. Already I told there is a formation of autoantibody against platelet membrane glycoprotein due to the viral infection. This autoantibody binds with the platelet surface glycoprotein. This antibody coated platelet when passing through the splenic circulation, then what will happen? Splenic macrophage recognize it and engulf and destroy it. This is called the thrombocytopenia. Remember this one. This is the pathophysiology. Now, what the clinical manifestation? Patient is seizure may be the just asymptomatic except bleeding manifestation. Except bleeding manifestation. Remember this. Bleeding from nose, bleeding from gum, bleeding from teeth, gum, then rectum. Just like this bleeding manifestation. Mucus bleeding. Mucus bleeding. Remember this. Mucus bleeding is the hallmark of the disease. Already told you in your book. You look your book. Mucus bleeding is the hallmark of the disease. Remember this one. Now what is the investigation? Investigate. First all you do complete blood count. Complete blood count. There will be thrombocytopenia. Then you go for bleeding time is prolonged, but clotting time and FETT will be normal. Then you go for bone marrow study. Bone marrow study, bone marrow study, erythrocyte and granulocyte series is normal, but a megakaryocyte is increased. Remember this one. This is the bone marrow finding. You should remember this one. You should remember this one. What happened? What are the findings of the bone marrow in ITP? Now, what are the differential diagnosis? Differential diagnosis with aplastic anemia, leukemia, hemoglobin purpura. This is a drug rash, drug associated thrombocytopenia. This is the differential diagnosis. Now what is the management plan? Management plan is very easy. Easy or supportive management than a specific management. But you remember this is the 80 to 90% acute ITP will be a spontaneous remission. Only 10 to 20% they develop chronic ITP. Remember this one. And there are 3 types of ITP. One is acute ITP. Number 2 is chronic ITP. Number 3, relapsing ITP. Acute ITP means when the signs come acutely and thrombocyte is going to less than 30,000 per cubic millimeter. There is a spontaneous bleeding. This is called acute ITP. What is the chronic ITP? If ITP persists more than 6 months, then it is called chronic ITP. Go through your book. Next is relapsing ITP. What is relapsing ITP? Relapsing ITP is Just it is a one acute like acute ITP, but it has got the characteristics of the remission and relapse. Remission and relapse. Remission and relapse. This is called relapsing ITP. Remember this one. Now, what the treatment plan? Treatment plan is very easy. Go in your book. In your book, what the treatment plan is very easy. The supportive treatment just to the immunoglobulin. IV immunoglobulin. Look to your box, not to me. IV immunoglobulin, 1 gram per kg of the body given 2 to 3 weeks. This is the IV immunoglobulin. Next, given prednisolone. Prednisolone should be given 1.5 to 2 milligram per kg of the body per day for several weeks. This is the prednisolone. Next, given some cytotoxic drug like azathioprine, then cyclophosphamide. Others immunosuppressive drug should be given for idiopathic thrombocytopenic purpura. Sometimes the chronic ITP is more than 6 months. That is not controlled by the medical treatment. Then we should do splenectomy. Remember this one. This is a very rare case. But blood transfusion and platelet transfusion is not be given. Not the treatment of the acute ITP. Never given acute ITP blood transfusion or platelet transfusion. Remember this one. There will be a grave. The condition will be worse of the patient. Remember this one. The prognosis 80 to 90%. 80 to 90% of the patient is spontaneous remission. Only 10 to 20% cases this develops chronic ITP. Remember this one. This is all about, my dear student. This is all about the gist of the idiopathic thrombocytopenic purpura. Thank you very much. Thank you all for patient hearing. So, okay.